Hello everyone, my name is Al Clancy. I am the Director of Training and Compliance for Health Plan Markets. I'd like to welcome you to our training class today. I'm enjoying delivering this to you from my front porch in Winter Garden. It's an absolutely beautiful afternoon, and I hope that it's a nice day wherever you are as well. So today we're going to talk about this is video number 2 in a 3-part series about working with dual eligible folks. The first one is a previously recorded program that I did, and that talks about the Medicaid redetermination that is beginning now and will definitely impact the landscape of the dual population going forward outside of 2023. So please, if you have an opportunity, please go back and watch that particular video. I think it's 20 minutes and 8 seconds long, and that's really what I'm trying to keep these videos, is at right about 20 minutes. And so today we're going to talk about kind of the structure of who these people are that are dual eligible. And then the third video in the series is going to be, how do you find them? How do you find them? Once you find them, what do you say to them? What kind of opportunities can you offer them? And so forth, depending on their level of Medicare and Medicaid. So let's go ahead and get started with our program today. So, just to kind of level set, DSNP, or Dual Special Needs Plan beneficiaries, have both Medicare and Medicaid. That's why they're dual. So the folks that have both of these programs have to qualify for each of these programs. So first of all, they have to qualify to be on Medicare. So Medicare itself, of course, is typically for the folks who are 65 and older and have worked at least 40 quarters in their career to have built up that Medicare eligibility. There are some other Medicare eligibility opportunities as well. One of them might be considered that if they become disabled and they're under 65, they are 40 years old, they get hurt on the job, they're disabled for 2 years, so they're on Social Security disability, but Social Security disability runs out after 2 years. So at that point in time, they become Medicare eligible, which allows them to take advantage of a Medicare plan of some kind, whether it's an Advantage plan or a Medicare supplement plan. Now, in addition to being Medicare eligible, they have to be Medicaid eligible. So Medicaid, the rules are a little bit different because Medicaid is a state-operated, state-based program. So the Medicaid rules are not the same across the board. The Georgia Medicaid rules might be different than the Florida rules, might be different than the Alabama rules, might be different than the California rules. So make sure that you are using the correct resource documents to be able to confirm some of the information with regard to the Medicaid eligibility. But if they are Medicare eligible and they are Medicaid eligible in their state, then they would be eligible for one of these DSNP plans, Dual Special Needs Plans. Now, these particular types of plans are very, very rich, and they can be rich in benefits because there are essentially 2 sources of funding for them. While most, if not all, dual plans have no premium that the beneficiary is paying, these particular products are funded through the Medicare program as well as through the Medicaid program. So there's a little bit of extra funding for these folks, and therein lies the reason that the benefits can be a little bit more rich than, for example, a traditional Medicare Advantage plan. So these folks have both Medicare and Medicaid, and no matter where they are on the spectrum, they can be essentially, almost newborns if they're born disabled, and all the way through death. So it's a very long list, a lot of different ages and a lot of different situations that can cause these eligibilities, but they do have to be eligible. So when you are working with the folks that are in this population, you're going to want to absolutely confirm that they do have both of these programs, that they do have Medicare and that they do have Medicaid, and you want to see the appropriate documentation to prove those facts. So most agents don't really understand the depth and breadth of this dual population, and I'm going to share a lot of statistics with you on this program today that I think will kind of open your eyes, or at least I hope that they do. So first of all, of the entire DSNP population, both under 65 and over 65, so it's a pretty big group of folks, 40% of that DSNP population are under the age of 65. 40% are under 65. 60% are 65 and older. Now, I think that statistic might come as a little bit of a shock to some people, but those are the numbers. So we're dealing with a situation where you're going to be able to offer a program, a DSNP program, Dual Special Needs Plan, which is a Medicare special needs plan. You're going to be able to offer that to folks who are under 65. And that really opens up a lot of opportunities for you to work in a much larger age range, as opposed to just doing Medicare Advantage, which may very well limit you to the 65 and olders. So this will give you an opportunity to really branch out. And then I want you to think about some of the other opportunities of working with those folks that are under 65. There may be some there may be some opportunities for working with family and relatives of those folks who are not DSNP eligible with ACA products, with Affordable Care Act. There may be some opportunities working with those family members that are not part of this for some final expense life insurance or some dental and vision programs that are not included in whatever plan they have. So you want to always be thinking marketing. How can I not take advantage? That's really not an appropriate word, but how can I see that there are opportunities out there and really look at opportunities that are and really kind of broaden my scope of my vision, instead of being tunnel vision into the Medicare and Medicare Advantage space. So 40% are under 65 and 60% are 65 and older. So I think that's a really important statistic for you to really land in your head. Another statistic is that 60% of the total DSNP population, 60% of the total DSNP population that is over 65 have some kind of disability. Wow. Now we're starting to add yet another layer of eligibility, right? So it's not only being financially qualified because of low income, low assets, which gets them on Medicaid, and then they can couple that with Medicare to be dual eligible if they qualify for that. But now we've got the fact that 60% of them have some kind of disability. That's another layer yet. So that's why when you see these DSNP plans, you're going to see a lot more rich benefits in these DSNP plans, because we're dealing with a very vulnerable population from a financial perspective, but we're also dealing with a very vulnerable population with respect to the medical care that they need access to. So another statistic that I find to be really interesting is that more than 50% of the folks that are over 65 on Medi plans have 3 or more chronic medical conditions. So now we're adding yet another layer. So these folks are not healthy for the most part, at least half of them are just not healthy people. They might have heart issues, they might have lung issues, they might have some kind of back issue. So these folks have medical conditions that, again, those DSNP plans have to be a little more rich to be able to give them access to the care that they're going to need for the medical conditions that they have. Here's another one that I really like. 61% of the entire DSNP population, or 4 out of 10, 6 out of 10, 61%, have some kind of cognitive or mental impairment. Wow. So now that adds yet another layer of, do they really understand the programs? Do they have an advocate that works with them, that helps them through these things, helps them understand what's being offered? So you want to be careful of that when you're interviewing them and they're looking for a Medicare plan. You want to be careful of that. You want to make sure that maybe there's somebody else there that can help interpret and understand what it is, an advocate, if not a power of attorney, but definitely an advocate. So what does that do? It might mean that you need to slow the pace of your presentation down. You need to make sure that you're not physically showing that you're rushed because you have another appointment to get to, because that might cause some anxiety to that particular beneficiary. So you want them to understand how fortunate it is that you and they have connected, because you can help them, and you can help get them on a great plan. 16% of this group of people, so 1 out of every 6 people, is actually physically located in some kind of a long-term care facility. So once again, there's yet another layer of folks who are in such physical or mental conditions that they qualify for being Medicare and Medicaid, and qualify for being on a D-SNP plan, but they're in a long-term care facility. Now, they may be actually qualified for a different type of coverage at that particular point in time, and it wouldn't be a standard Medi plan, but there are some folks in there who would be and would qualify for that if they don't have a loss of very many of their activities of daily living, and they still have the ability to make decisions on their own and get around on their own. So in addition to all these layers that we've put in here, now let me give you a couple of more things. So first of all, this particular group of folks tends to be very unstable when it comes to their housing. So anybody who has these folks on the books and they've sent them a piece of mail, if you're sending it first class, you oftentimes get things returned. I've seen postcards go out from carriers, and literally half of the postcards that go out to the D-SNP population come back undeliverable because they're not at that address anymore. So make sure that you have the accurate address, make sure that you have the accurate telephone number, and also think about that a lot of these folks don't have landlines, they use cell phones, and sometimes they use cell phones where they're buying the cell phones with prepaid minutes. And what happens when they run out of minutes? They may reload, or they may go buy another cell phone and that has a new number. So make sure when you're taking that application, kind of off application, that you're taking down the name and telephone number of an alternate contact. It might be a child, it might be a grandchild, it might be a neighbor, it might be a good friend, somebody who can help you if you need to get a hold of this beneficiary. That is the reason that a lot of agents lose dual folks off their rolls, is because they can't get in hold of them, and those beneficiaries think that the agent doesn't care, and they go elsewhere and look for a plan for the following year. Transportation is always an issue with the D-SNP population, so make sure again that you are offering them the transportation benefit, and they understand the transportation benefit that might be in their particular dual plan. So in addition to financial deficits, in addition to cognitive deficits and insecure housing, there could be some low healthcare literacy. So this is a situation where it's hard for these folks sometimes to trust people. And that's why when you go in there, that's the first thing, that somehow, some way, you've got to get them to trust you. And you're not going to harm them, you're only there to help them. And so because they have lost trust in some people in the past, quite frequently they get their information from neighbors, family members, friends, and not from people like us in the business, because we know the sources of truth and we can make sure that we're giving them the right information. So that's really important to know as well. This is not going to be a 15-minute. Appointment. You're going to be spending some time with these folks, and making sure that you do it correctly. But once they trust you, once they see that you have nothing but their best interest in mind, there is no better group of people in the Medicare space to get referrals from than there is the dual folks. So you want to make sure that you are constantly asking that question, or at least periodically, maybe not constantly, periodically. Hey, now listen, as I talk to you today, I want you to think about any of your friends and family that may have that I might be able to help when I show you some of these things and answer some of your questions that maybe they've had questions with, and they might like to work with somebody like me. So plant those seeds a couple of times during your appointment. And another one to really focus on, in my opinion, is the transportation benefit. You know, most of these folks do not have good, solid transportation capabilities. They don't have reliable sources of rides. So the transportation benefit within the Medicare Advantage plan is really important, and make sure they understand how to use it. And I mean to the T. If they have an appointment on Tuesday morning, they can't call at Monday at 3 o'clock in the afternoon and expect to get picked up on Tuesday. There are no transportation companies that work like that. So you want to make sure that they understand that they want to give that leeway and that latitude. So the number one focus for these folks is obviously going to be their primary care doctor. That's their hub. So when you think about a bicycle wheel, you think about that spot right in the middle, that hub where all the spokes connect to. And that PCP is really going to be their hub. And based on what I just said, they could have more than 3 chronic conditions. So they're seeing a cardiologist, an endocrinologist, they're seeing a skin specialist, they're seeing this, they're seeing that. They could be seeing 8 or 10 different specialists. So think of all those as spokes kind of going off that wheel. And you want to make sure that they understand how to use the plan with regard to all of those physicians that they need to see. The second thing, and that should all route through their primary care physician, quite frankly. Secondly, their prescription drugs. And you know, if you've been in the business any length of time, you know that quite frankly, many times that these folks will bring out a Publix bag full of prescription drugs. Some of them may be valid, some of them may not be valid. So you know, the situation is that you want to make sure that that you understand which ones they're currently taking. Look at the prescription bottles. Make sure that they're not showing you expired. Make sure they're not showing you duplicates of the particular medications, and make sure that you translate anything that's on the bottle. So if there is a generic, for example, and you ask them what that medication is for and they don't know, look it up on your friend Google and make sure that you know exactly what that's for, and then lead them in the right direction with regard to their doctors. So also make sure that you check their ID. They should have a state-issued ID of some kind. We have a lot of folks who come here to Florida. We had a huge influx of people from Puerto Rico, for example, many years ago, and it turned out that they had not created residency here in the United States yet, so they weren't eligible for some of these plans. They weren't eligible for Medicaid, they weren't eligible for Medicare. Some of that softened a little bit, but if they have just sold their house in Michigan and they've moved down here and they still have a Michigan address, they still have a Michigan driver's license, they need to be domiciled, if you will, here in the state of Florida, if we're talking about Florida, and in the state of Florida, so that they can make sure that they qualify for a Florida plan. And then additionally, make sure that their zip code is correct. There's a little neighborhood down there in west of Kissimmee called Solovita, and literally within the neighborhood of Solovita, there's a street where one side of the street is Osceola County, the other side of the street's Polk County. So you want to make sure that you clearly understand where they live, the correct zip code, so that you put them in the plan that is most appropriate for them based on the zip code. So I hope that helps you kind of identify a little bit about the strategies that you should have as you walk in for that appointment. And really beginning to understand that. There's another training class that I'll be doing in the future called the sales cycle. And number one, the first part of the sales cycle is building rapport, breaking the ice. What do you say to these people? How do you begin to build a relationship with these folks? And we will be talking about that because it can be quite different for working with duals than it is with other types of beneficiaries. The duals just don't have as much trust as the non-duals do with anybody that they're working with, and they tend to get their information from friends and family and neighbors as opposed to professionals. And so sometimes you have to, treat that with kid gloves, but you have to make sure that they understand that you are the professional and that you do have the answers that they need. So thank you so much for joining us today, and look forward to hosting you on a future video. Thanks.